It's time to take a look at stories making the headlines in Nigerian newspapers. And joining me via Skype is Managing Editor, the Avalon Daily, Ayodele Adio. Good morning. Thank you for joining us on TVC Breakfast.
Good morning. Thank you for having me.
All right, let's head straight to the papers now. And I begin with the blueprint. INEC keys into COVID-19 protocol, creates e-platforms for submission of nomination forms, tracking campaign finance, engagement with stakeholders, meeting with party leaders, briefing on observers. While Commission releases timetable for Edo-Ondo gubernatorial elections. Well, news to the News Direct now. COVID-19, WHO suspends trial of hydroxychloroquine as treatment. As global cases hit 5.49 million, Nigeria records 8,068 cases. Then we move to the Daily Times now. Declining GDP, recession looms as Nigeria's economy grows marginally by 1.87%. Agriculture, ICT major non-oil contributions in the first quarter of 2020. All right, let's move to the front page of the Daily Trust now. COVID-19, self-medication worsening our problems. Patients. My husband asked me to take chloroquine. Pharmacists, patent stores making brisk business. Federal government, health experts worried. We'll look at that story shortly. And to the Leadership newspaper now. COVID-19, WHO suspends use of chloroquine for treatment, says drugs increase death rate, cardiac complications. Infected persons can't transmit virus after 11 days, new study reveals. And finally, on the front page of the national economy, despite challenges, Nigeria remains attractive investment destination, experts. GDP grew by 1.87% in first quarter. That's the National Bureau of Statistics speaking there. COVID-19 fixed income market will record increased activity. Onyema. All right, let's go to the story on the front page of the Daily Trust, still related to the fact that the WHO has banned hydroxychloroquine, but we have seen that a lot of persons are self-medicating, and that is creating a source of worry. First, let's get your view on WHO's ban on the use of hydroxychloroquine, saying that it can cause cardiac arrest and the likes. We see that Lagos State government some days ago was saying that it was going to perhaps carry out a clinical trial of the drug, but now WHO is banning it. What do you make of this?
First of all, I think that I'm not sure why it was suddenly banned. It looked like we're going to get some ray of hope from the hydroxychloroquine, because a few scientists had claimed that it was effective in treating the COVID-19. But of course, WHO have gone into a series of trials of the drug and suddenly found that it causes heart diseases or heart complications in certain persons, and as such, was not going to be recommended for the treatment of COVID-19. So, if that's what the WHO are saying, who am I to disagree with their position? I am only worried that that same drug had been used in Africa for quite a while to treat malaria and all sorts of ailments, and why it wasn't flagged at the time that it had serious implications on the heart is what baffles me.
So, but then the concern again, like what we see on the front page of the Daily this morning, talking about the Daily Trust, self-medication worsening. A lot of persons, going over the counter to get this drug. What measures can the government put in place to curtail people purchasing this drug? Because it's already generating a lot of concern. People are developing hydroxychloroquine poisoning.
I think, first of all, the government needs to ramp up its communication. I've said it every time I've been on this program. The government needs to engage with its people, and it needs to engage its people via persons that it trusts. That is religious organizations, on-air personalities, celebrities, and what have you. It needs to engage vigorously to ensure that people are not taking the wrong medication or abusing whatever medication that they are taking. So, I mean, it's the job of the government to ensure that it gets on the radio, it gets on television, it gets in the newspapers, and gets the word across that this drug is dangerous for you, and hence it should not be abused. It also should go a step further to warn pharmaceutical pharmacies across Nigeria not to sell such drugs without doctor's prescription, and stores that sell those drugs without doctor's prescription should face the wrath of the law. So I think it's not such a difficult thing to do if it engages and communicates with the people, and if it ensures that all pharmaceutical stores across the country comply with a simple directive of not selling a drug without a doctor's prescription. Of course, you would say that the black market will fill that gap. Then again, to mitigate the effect of the black market is for you to now communicate to the people directly to tell them that they will be putting themselves in harm's way should they take a drug that is sold from an unauthorized pharmaceutical or pharmacy or a pharmaceutical outlet and put their lives at risk.
Some would say that obviously this sin or this whole situation begins to, show that there is the critical need for a homegrown solution, and which is something that a lot of Nigerians have been pushing for a long time. Do we have that capacity, even if we are to come up with something?
Well, I mean, I don't want us to get ahead of ourselves. I don't know what a homegrown solution will actually look like, but here's what I know. What I know is that 90% of people who get infected with this coronavirus would not need hospital treatment or hospitalization. Statistics have shown that at least 80% will recover without even any serious symptom. So in my opinion, if I were to suggest, and I think that the route or the routes that the Lagos state government wants to take is laudable, which is to ensure that it educates people on how to treat themselves or take care of themselves should they fall infected with the virus at home. Because here's the thing, Veronica, if by projections, you can see that the numbers are climbing every single day. And if we go by what the Commissioner of Health had said 2 or 3 weeks ago, that we could have 120,000 infection by August, it means that 3,000 of that number will need hospital beds. And the Reuters report that got published 2 weeks ago had told us that the country has less than 4,000 beds across the country. So if only Lagos needs 3,000 hospitalization, where are the beds that will cater for 3,000 people? So what needs to happen is that there needs to be a campaign of how people can take care of themselves at home should they fall ill from the virus, because over 80% of the recoveries around the world did not need to happen in hospitals. So what needs to happen is for government to engage citizens on how to take care of themselves at home, and the standards that they should follow and the measures that they should follow should they get infected. Because the reality is, like you rightly said, we don't have the health infrastructure to absorb a lot of patients flocking the hospitals.
Ayodele, we have to leave the conversation here for now. Thank you so much for speaking with us.